So I'd like to thank you all for joining the show. I have with us a very special guest. I call her my co-host. Her name is Cynthia Montgomery. Hi,
Hello.
Cynthia. Cynthia is an RN in Omaha, Nebraska. And so we want to ask her some questions about healthcare disparities as it relates to the nursing field. So how you doing, Cynthia?
Well,
Doing well?
just, trying to get through all the fun stuff. Always something to read.
Right, especially now that we have COVID in place and all these new variants coming up. It's just crazy. Well, let's just get right into our first question. Our first question has to do with variations of depression. Cynthia, can you talk to us about that as relate of being a nurse and RN? For many, many years, I would like to say that. Many, many years. I won't tell how long unless she say how long.
Golly, I believe healthcare is a continuum in general. So whether I was a nurse or I was another form of like RN, because you're in nursing for a long time, you just end up doing these things and learning them along the way. Even regular people learn all of this stuff. So I've been a nurse around 15 years.
Right. Long time. So let's talk about some different variations as it relates to depression. We can talk about low depression. We can talk about major depression.
Well, many people at some point do experience sadness and anxiety, temporary depression, whether they're dealing with life or if they're dealing with chronic illness. So the National Institute of Mental Health explained that unlike temporary feelings of sadness or happiness, clinical depression involves symptoms that persist over a period of time and have a negative impact on their daily life and ability to function. So the challenge is to recognize the difference between these symptoms of being temporary or just contextual, you're just sad, or symptoms that have identify that depression. They're routinely misdiagnosed and they have to be treated for while being simultaneously treated for chronic illness. So it's been estimated that like 10% of patients experience a major depressive episode.
Yeah. Yes, I agree with you. And when you were really full-time practicing, I know that you saw a lot of that going on. How did you handle that as seeing patients as an RN?
Well, it depends on, in general, what you want to do is you want to troubleshoot through it. So because people can have poor outcomes with that depression. Because when they are recovering from an illness, it's hard to not say, hey, all your problems are due to the fact that your heart rate is just elevated because of whatever you're going through, or that your oxygen is low because of the disease process you're going through. Well, that kind of has a cycle, a whole cyclical effect to it, so that you have to really kind of pull it apart and you have to do a lot of talking to try to figure out what is the disease process for the chronic disease and what is the depression and how they feed into each other. For instance, if you end up, you're getting help for one issue and you need to do exercise or deep breathing treatments or something, maybe you just, or take certain medications, you may skip a day of meds, or you may not feel like exercising that day because of the depression. But is that also because maybe you have shortness of breath that you don't realize is shortness of breath? And so it's all like together, and it really does take your team and you really talking it through so that you have good communication so that you can work on these problems together and
so
get the support you need from your family.
Right. So I bet during your practice and your years of actually being a full-time RN, you did a lot of referring patients for mental health services, one-to-one counseling or family counseling.
Yeah,
you
you
know.
have to work with the larger team. It's not just me. It's you got your doctor. The doctor has specialists that they're going to possibly send out to. You've got your therapist that you're working with. You have just the family that might be able to help, but sometimes it may not be the best for them to help. And you've got your community at large, friends, and just in general, people that just want to be a good citizen and help you out.
Right, right, right. And what the world is going and facing with today, depression is probably at the top of our mental health, not just with adults, with children.
Yeah.
As well, trying to navigate through school and not being able to go to school every day. So what can you say to our young people that might not even know what is the word of depression? It might be feeling some way, or parent that might see some small signs and just kind of pass it over as my child's just having a bad day today.
Well, there are resources that can help people. But like in general, if you just happen to notice that their mood is down, they have a loss of interest in activities, they don't have the energy they used to, they're sleeping all the time. Now they can't sleep and they're up constantly. They can't concentrate. Um, Maybe they're not eating. Your kids just stop eating, or they're like, I'm not eating with the family, or something's going on. The hard part is that communication, is to be able
Right.
to sit down with them and really get a chance to talk to them, regardless of how you feel about their problem, and getting past that bias of what their problem might be.
Mm-hmm.
But you've got to sit down with them and then use the resources around you. Look for those phone numbers. Find out from your doctor, what can I do to help out? Boys Town even has resources here in Omaha for your children, so that they have a whole hotline that if you have questions, you can call and ask.
You,
So
Mhm.
go ahead.
I'm sorry, go ahead. Yeah.
Um, but no, sometimes even you might have people that like they aren't moving much versus like they find that they have to move all the time. That's
Mm-hmm.
also a form of type of a depression.
Mm-hmm.
So, and then at the end of that is also suicidal ideation. Do they have a plan? Are they really thinking about that plan? Are they getting the stuff for that plan?
Mm-hmm.
If they're really getting into that.
Yeah, so we have a lot of barriers as it relates to depression, in a cultural perspective,
Absolutely.
especially with our Black and brown communities. Can we just touch on those disparities, about as it relates to going to a doctor, a mental health doctor or a psychiatrist, when you might refer them? It's probably a low rate of people will probably try to do that with the Black and brown community.
Well, a lot of it is not even knowing if you have access to people within your community. Like literally, they're not located in the community. That's a problem.
Yes,
And
major.
do they look like you? Do they share some of the same values that you do? And getting that information out to people has been more difficult. It's harder to see those providers within the system of providers. So their visibility needs to be made more clearly to the community so that they can use them. And yeah, they do have all of we had cartoons back in the day that even made fun of, the quack. There was always a duck on screen, and
Right.
maybe they might put up a witch doctor even. Just constantly trying to berate the community with images of, you wouldn't want to deal with that. That's terrible.
Right. Right.
So, but the sad part is that shuts people down from understanding themselves,
Mm.
from being able to solve their own problem, from
So I
being
bet,
able to accept help from others to solve problems.
right, and I bet you do a lot of educating that person that you're referring to, help them with a match, of a
Yeah.
professional in their area, because matter of fact, when you say the word mental health, that's kind of like a taboo thing in the Black and brown community,
How
right?
dare
So
you?
you have to do a lot of, matching and educating and helping them to find a person that they can relate to, as you said, looks like them and understands their culture, so they will be, more acceptable to call that person once they leave your office.
That's
Yeah,
right.
yeah,
Ring, ring, give them a call as soon as
yes,
possible.
right, right,
Yeah,
right. And
but
we,
we also have to get past the stigma of our family. The
yeah,
moment that we sit there and say, I'm gonna go get help, and they're like, man, you didn't need no help. You just need to
right.
go downstairs and get your butt kicked by cousin such and such.
Right,
Leave y'all
right.
two in a room, let y'all duke it out. I'm like, that's not gonna help.
No, no, that's not going to help. And so in the Black and brown community, we have a lot of stigmas. I mean, as far as mental health is concerned.
Which is
Um,
placed on the Black community.
yes.
Not necessarily that that was their whole thing, because they did talk. And matter of fact, if you go back to spiritual hymns, you can hear in blues and all of that, they're trying to talk that out
Mhm,
within the
mhm.
context of some of that stuff.
So
Even
you
going
think
into
maybe,
the church is a way to deal with your mental health.
right? So you think maybe society um, had a way of making it more of a stigma as what they see on the media
Yeah,
or in what they might hear in certain arenas,
right.
as it being taboo.
Absolutely.
Because as you said, it's been in the church. You hear it in Black and brown culture music. You know what I'm saying? So what happened, it got lost some way because people are really scared to go talk to a mental health professional.
Absolutely.
Especially if it has to do with a psychiatrist wanting to give them some type of medication, are not even understanding their family dynamics as it relates to mental health. There's a big thing, not understanding the dots and the correlations and things like that. As we were talking about with Miss Cynthia about mental health and the generations of mental health, one of the things that I learned as a mental health provider was to learn was to do mapping. Mapping is really important when it has to do with mental health because people do not know there is mental health diseases that are generational. And mapping helps them to understand maybe what was going on with a loved one that is no longer there anymore, that was struggling and suffering with mental health. So we're going to go on to our second question. Cynthia, let's talk about the importance of an annual wellness check and how to better communicate with your doctor on this.
Yeah, annual wellness checks can be kind of confusing. Most people don't even understand what they are because they think that it's the same thing as the yearly check that you go and get your whole blood work done, and it's not the same. So, the annual wellness check is a yearly appointment with the primary care provider, and it creates a personalized prevention plan for you.
Right.
So, what the purpose of that visit is to screen for diseases and assess the risk of future medical problems and encourage a healthy lifestyle. Update your vaccinations, and most importantly, build a relationship with the provider. Just in case you were to get sick, you want somebody that you can trust by your side. If they don't know you, that's more difficult.
Mm-hmm.
So, and annual wellness checks are not the head to toe physical. That's actually the time that you communicate with all of the healthcare team. And this is done under the direction of the doctor, which is the provider. However, you don't have to necessarily do it with the doctor. It can be done with another professional, a physician assistant, a nurse practitioner, clinical nurse specialist, urgent care provider, telehealth providers, medical assistants, even the pharmacist, health educators, registered dietitians, and of course, nurses. All of these people are under the guidance of the doctor. The doctor will be reviewing everything, and they're there to listen to you. And that communication is so important because it can block the meaningful evaluation and diagnosis for your individual situation. It's hard to get to the bottom of everything through a test. You've got to understand how important you as the individual is to even understanding what's inside your body. Only you have truly that knowledge. And there are a lot of things that can get in the way of that communication.
Mm.
A lot of times it's maybe you don't trust your doctor. And so you can't build trust if you never talk to them.
Right. Maybe
On top
intimidation a little bit,
and
because they are the
intimidation,
medical, yeah, they are the medical doctor and
right?
maybe, right.
They may decide, you may think that they're going to tell your work and be like, oh, but my insurance, I don't want them to know.
Mm.
That is why we have certain protections in our insurance now,
Mm.
so that there isn't like a workplace issue.
Mm.
If there is, you can challenge that.
Right.
But you have to, but find somebody within the healthcare team that you can truly understand that with. You can actually get to the bottom of a problem that may not be as severe, may be managed with a simple, easy medication or changing up something versus a whole surgery because you waited so far down the road or had a stroke because you didn't get hold of anybody to even understand what was going on. And that
Mm.
you had these things that happened over a course of time that you never said anything about.
Yeah. That is so true, Cynthia. And there's variations of wellness check based on your age,
Absolutely.
and so people need to understand, what they might wellness check might be for the age of 60 is different from a wellness check from the age of 40. You
True.
understand? Yeah, yeah.
And as kids get older, there's a difference in the wellness check from when you go into the doctor and you just talk about, what the kid's been going through versus when they hit puberty.
Mhm,
And that's a whole nother thing, especially, for young girls and boys and what that means for them.
mhm. And even as an adult, when you start getting your colonoscopies and and your breast examinations, and those things that different vary on age appropriate. So
Right.
communication, it probably is really good to actually ask the doctor at my age, what other things that I might need to do as a wellness check, because wellness check does not mean it all comes from your primary doctor.
Mm-mm.
He might have to refer some of that stuff out to a specialist because of your age. Is that correct?
Yeah, the wellness check overall can help determine which direction you might need to go in that year. You
Mhm.
might have gotten everything like your cholesterol and your A1C and what your blood pressure is and how tall you are this year. And then you go in for your wellness check and you find out, well, you're kind of working on this other thing over here that like your leg ain't acted quite right, or maybe there's some color changes going on in that leg. And but yet you don't see anything wrong with your blood pressure, your A1C is fine, and everything else looks good. The cholesterol looks good, but come to find out you've got these changes happening. Now you might need a Doppler study of some sort. And then you're going to be pushed maybe toward more of a specialty for vascular studies. So there are just things that you have to talk to your doctor about and be like, I noticed this mole over here.
Mhm.
I've noticed that my ear funk don't smell right.
Mhm.
Say it, it's fine.
Yeah, yeah, and also too genetics too.
Absolutely.
Because heart disease is genetically done. Diabetes. You know,
It can be a mix
and
of
even some
genetic.
variation of cancers. You know
Absolutely.
what I'm saying? You might feel fine all the way to your 40s and 50s, and then all of a sudden, Jericho comes falling down. You know what I'm
Who is
saying?
raising them horns? Put them horns down.
Yes, and then you like, oh, and then you talk to your doctor and find out, your grandmother or your mother or your father or his mother or father has some genetic things that could be affecting you. So communication is really powerful. When you share those things with your doctor, a lot of people worry about confidentiality. Can you just speak on that to just ensure people that their records are confidential?
They are, because it's called HIPAA. HIPAA the hippo. Always on your backside, letting you know.
Mhm, mhm,
And you want to understand that, like, whatever you say to the doctor is between you and the doctor. And that doctor can only tell the healthcare team of importance based upon third party privacy rights.
Mhm.
So you can only have the doctor talk to that specialist as long as that's the direction you're going in. You can only have the doctor talk to the nurses because they're all signed under that contract. They're not out there going, hey, I remember you had, nope, they're not, nope, yeah, no, that's a HIPAA violation. You can't do that.
Right, right. And that happens when you have small towns, and everybody knows each other, and that's like a fear of
Yeah.
people, and a fear of people not even wanting to go get their wellness check because they don't want anyone to know in their community what's basically going on.
True.
So that confidentiality, we can't overemphasize that to our viewers that, the records are confidential, and that if you share that with any medical team in that doctor's office, that your records are, your records are sealed. And we encourage people to not go to the doctor because of that fear. So let's go talk about our last question for today. For today. Sure, go ahead.
If you let that fear get a hold of you, what ends up happening is that cost that you were trying to maybe avoid ends up being astronomical because you didn't come in until you're super
Oh, so true, so true.
And it may not be able to be reversed as easy because it's easier to stop eating 2 pieces of salami on your sandwich than it is to be like, you can't have sandwiches.
Right. So the early detection is the better.
Absolutely.
And so if you're feeling some way different from a normal situation, don't take that for granted. If it keeps bothering you, and it's maybe progressing, go to your doctor and share that information, because it could be something ruling that, is genetically, what I'm saying, in your family trait that maybe you didn't know it or you didn't understand that.
Right. And
so do you want
guidance in your healthcare?
Yes, I agree with you 100%. So viewers, please go to your wellness checks. Please do not take that for granted. Can we talk about the last question, Ms. Cynthia?
Indeed.
Okay. House disparities within society, such as race, trauma, and anxiety. And sometimes it has to do with monetary status. Money. People don't want to go to doctor, don't have no money. Right. I don't have the co-payment. Even the $10.
I ain't got nothing.
Right. That's a big one. Can you share some thoughts and concerns about that?
Well, I guess that for me, when I think about it is that even if you don't have money, there's resources out there to help deal with that. You have sliding scale, you have access in some states, currently ours, there's some amount of new access to even Medicaid. So we are more able to at least overcome some of the financial burden a little bit. So getting people in there helps to address the systemic diversity issues with actually getting the care you need. Because if you are the guidance of your healthcare, you can look the doctor in the eye and go, doctor, I feel like you're not listening to me. This is what my problem is. Please explain to me why you're not listening to me right now. Don't be afraid to ask these important questions. So for me this year, clinical trials have been really important. So when it comes to getting Black and Brown communities to participate in clinical trials, you want to make sure that the clinical trials are not geared in a way that it takes out people because they have too many comorbidities, too many things that make them sick, or that their socioeconomic status, they're just too dang poor, I don't care about them, they're not in middle class. But we are accumulating evidence that having the participation actually helps us understand and it seems like a no-brainer, actually helps us understand that there is a diversity sitting there, that the medication could work better if only we had the rest of the picture.
Right.
Out those people there, you don't have a completely clear picture of how the medication truly does work.
So that causes trauma and the anxiety because of the lack of education,
Yeah,
because of the lack of understanding, because of the lack of the communication.
absolutely.
Why people won't, won't go to the doctor, will not go to the doctor,
Don't
will,
go in the
will
clinical trial.
suffer with mental health issues.
Yeah.
We can just go on and on with numerous things
Right.
that have to do with the health disparities when it comes to Black and Brown community.
And again, all of these resources, whether you're talking the clinical trial, the access to information, the hi, I don't know what I need, and I need to have someone explain this to me in a meaningful way, it's not located in the community. Not
Right.
very well. It's not easily accessible. Like going down to the corner store should be. I can go down to the corner store and get myself a pack of cigarettes and a drink, but I can't go down and get some health care. What's up with that?
Right. Right. We need to do a better job on extending health care to all, no matter what their financial or economic status or their living conditions are. Healthcare should be a norm. It should be a given, but it's not in the United States. There's a lot of criterias and jumps and hoops that you have to go through
And
to get healthcare.
is part of people in general, all around the world. You don't have to have a witch doctor. You don't have to have, you know, something that is akin to just religious health care that the nuns at the nunnery were doing. You don't, it doesn't have, doesn't have to be on just the battlefield. It wasn't only happening. We needed a healthcare only for war. That's not where healthcare came from. It came from people realizing, hey, you're sick. What do we do to do something about that? And now we're trying herbs and medicine, trying to figure out what will solve the problem. In general, all of us care about healthcare. We
Right.
all are trying to find a way to fix ourselves as well as those we care about next to us, whether it's a friend or family member.
Right. Right. We just need to do a better job and resources out there.
Absolutely.
Because first ideal, if you're scared, then you need to have someone that you can talk to. And that's the first step, trying to find that person that you can talk to other than your family. But if you do have a family that you can talk to, please do that first. If you do. If you don't have a family to talk to, then what is the next step to go to? Maybe your pastor in your church. You can visit the pastor in the church about the resources or where to go to. Then you can go to like your community health care facilities in your area that you can go to and maybe talk to, and maybe just talk to the reception, not giving all your confidential information, but maybe just asking for who can I begin to talk to about my problem in confidence. So is there any last minute things that you would like to share with us, Cynthia? We had a great conversation on healthcare disparities. I mean, this is going to be great for our viewers. So anything else you want to end with?
Well, I figured I'd bring up what I consider always the elephant in the room for Black and brown people to me, which is that doggone Tuskegee experiment.
Oh, yeah.
I always hear it in the mouths of people just walking down the street.
Yeah, that's horrible.
So it's a terrible experiment. Holy crud, what the heck did they do? They didn't have informed consent. They gave out medication that wasn't medication. It was just pretty much sugar pills. And so they didn't do any actual experimentation in that way. They just let them live. They just didn't treat them.
And then they let them live with the virus, with the disease for many, many years. And after they found a cure, isn't that what?
That's right. They didn't treat them.
They
After
did.
they found a cure, they said, I don't know how that's going to play out.
Yeah, yeah. So
And
this is what goes on. It even goes on. It went on a lot in our prisons like that.
yeah.
When,
I mean, well, there's a lot of other constraints there that stop medical care from happening. That's not always on healthcare providers that want to do more. Sometimes it is. Sometimes it is a healthcare provider that wants to run their own experiment and cause, so because they believe in something, but they didn't go through the right channels and didn't get consent and didn't do all the things that they were supposed to do. And that's wrong. They shouldn't do that. Because we have laws and ethics and morals.
right, that help us navigate through all that.
And
so
just to be clear, ethics and morals here real quick. Some people just don't know what that means. It's just
well, why don't you give us a little?
Is for policy and procedure, like how we're going to do that. Where morals is how you believe. What is the belief system behind that? So that's ethics and morals when you kind of talk it out. Most people don't know that.
No, they don't. They don't. And one last thing I would like to say, and I know you agree with me, when you go to your doctor, we have a habit of saying, I understand, but you don't understand. It's okay to say, please, can you explain it to me again? It's okay, viewers, to say that, that you do not understand, and ask your doctor to either repeat it, or maybe he'll get the nurse practitioner or one of the other teams to come in there and explain it to most hospitals and doctors are trying to go with a navigator, the community healthcare worker approach. We need more of those, because I am a community healthcare worker. And so I spend a lot of times on explaining to people that call me about their concerns and how to navigate through things where they didn't get that by calling that number that I actually am going to refer them to. They didn't get that. And so that's why community healthcare workers are very good. RNs are very good. Navigators are very good in the healthcare profession. So we need more caregivers to be able to take that time, that 15 to 20 minutes more time, and talk and educate and communicate to that patient. Do you agree with that, Cynthia?
Absolutely. Because you have to be able, part of nursing is teaching, but we also have a time constraint, and that's problematic. Yeah. So whether it is we find you videos, or if that's not enough, call us back and say, I watched it. I didn't get that. That's fine. If we need to set up a time that we can, like, one-on-one with you, draw it out, have you understand a complex situation, like if you're a cancer patient and you don't understand how that med's going to work, you got to know before you take the treatment so that you can feel confident in how you will even handle the problem that is directly in front of you, because you will have ways that you can protect yourself and the people that are around you, that you can help them help support you, right, by just having the knowledge that you were supposed to have.
Right. So I'm going to leave this with giving our main number to call us. You can leave a message for both me or Cynthia if you would like to have one of us to call you back. You can call us at 402-451-5549. It's a 24-hour answering service, and it's live. So you won't be happy. You're talking to a live person 24 hours a day. We'll be more than happy to call you back. It'll take us 24 to 48 hours to return your phone calls. Please be patient. But we want to reach out and try to help as many people as possible that are dealing with some of the areas that we are talking about. Thank you so much. Hey, Cynthia, thank you. I will see you next time, girl, on the show. Thank you so much for our audience for viewing us on the show. We'll have more to talk about on health disparities. Good night. Bye-bye.